Unlike the police chief and the mayor, the city's medical officer of health says safe injection sites for drug users may be a good thing from a healthcare perspective, and we should have a serious discussion about them. We toured the proposed site in Sandy Hill earlier this week. In a post on Ottawa Public Health's website, Dr. Isra Levy says injection sites save lives. Dr. Levy joins us now. This may not be a controversial position for many doctors, but Chief of Police and the mayor are saying not a good idea. Why are you on a different page on this?
I think actually we're on very similar pages. All of us care about the people that are actually potential clients, and all of us come at the kind of approaches that, or the kind of things that need to be done for the people that might be potential clients and their families and their communities from slightly different perspectives. But the notion that treatment, prevention, and harm reduction are part of the fight, if you like, against substance abuse and substance misuse is something I think that we share in common with each other.
You acknowledge this one in particular, NIMBYism, not in my backyard, is very, very strong for obvious reasons, and you also acknowledge that's a legitimate concern for people who are opposed to this idea.
Yeah, I think it's the kind of thing that people worry. They have images conjured up of some of these standalone facilities that we've seen in other parts of the world. I think the advances in the discussion that's taking place in Ontario right now is that this is a different kind of thing that Sandy Hill is proposing, and that we've seen proposed in Toronto in the last month or so, compared to what, for example, people have been concerned about in downtown East Side Vancouver.
Can you do it without council support?
Well,
not you, but can it happen without council support?
As we understand it, really what's required is a proposal to go forward from an agency that wants to do something like this to the federal ministry. And the Federal Minister of Health would consider letters of opinion from a number of different entities, including the police, the law enforcement officials, the public health officials, and the city. And how they would interpret what the city is, I can't really speak to, but I think we all want to be in the same place.
Briefly, you say yes to one and maybe more.
I think what we really want to be doing is meeting the needs of people, and we know that people throughout the city use injection drugs, so why we'd want to locate it in a single location, I'm not sure. I think it definitely warrants looking at the value of mobile sites.
Dr. Levy, appreciate your time. Thanks for coming.
Not at all. Thanks for your interest.